Hello, everyone, and welcome back to Psychology Eats. So, what's eating you? Today's video is about suicide, a successful suicide. So, in the world of psychology, we talk about someone having a successful suicide or unsuccessful suicide. So, a successful suicide is when someone successfully ends their life. And so we know there are many ways that someone could kill themselves. And so obviously in this field, we're trying to prevent people from hurting themselves or anyone else. But there are many successful suicides every day. And so as clinicians and psychologists and psychiatrists, we want to help families and friends of people who have thoughts about hurting themselves. I think it's important that the people around the person can recognize some warning signs that the person may be at risk of committing suicide. So one sign is that the person has a diagnosis of depression. So they already are battling depression, and so they may be at, obviously people with depression are at a higher risk for having thoughts of suicide. So then that's something that you need to just be aware of. The person may isolate. You may notice like your friend or a family member, they stop coming to events, they stop returning your phone calls, and they're spending more and more time alone. That's a sign. The person can verbalize, I want to kill myself. I feel like I want to kill myself. And so they're verbalizing exactly how they feel. That's a warning sign. I don't care if they said it a million times and didn't do anything about it. Whenever someone says it, you need to take action to help them. The person may stop making future plans, so they don't want to make a commitment to next year or next week or next month because they're having these thoughts of wanting to hurt themselves. They may begin to give away items. I know when I work with people with depression, chronic depression, and they like, oh, I made you something, or I want to give you a gift. And then they don't want to make their next appointment. That is a huge sign that, first of all, they're giving me like this going away, this goodbye present, and then they don't want to commit to their next appointment. And so that is a sign that they may be having thoughts of suicide. So the best way to prevent suicide is for, if someone has a diagnosis of depression, obviously they should be in treatment. They should be, receiving ongoing treatment that may or may not include medication, but just being in treatment. I've had many clients come in a session and say, I'm glad I made it today. I've been thinking about killing myself. I've been thinking about, and this is how I plan to do it. And they may have a whole plan on how they will plan to kill themselves. So luckily they're in treatment, and I can move accordingly to get them stabilized and get them help. But some people don't have a counselor, clinician, or somebody that they can go to, so they may say it to a family member. And so you need to take that serious when someone says that they have a feeling that they want, or thought that they want to kill themselves. And you should take them to the hospital to get an eval, and let the doctor, a psychiatrist usually on duty, or someone on duty there in the psychology department, that they can make an assessment to see, if they need ongoing treatment, in which they probably would. So there are many reasons why people commit suicide. Sometimes people can go through traumatic events in their life, and they live through it and they manage it. Some people can't. So depression, trauma, loss of a family member, loss of a relationship, loss of a dear animal that you held dear in your heart could have give some people thoughts of suicide. Anger, someone's really angry about a situation, and it's almost like, I'm going to show you now, I'm going to kill myself because you pissed me off. And so I've seen that before. Addiction, someone who's in their addiction and they're just tired. I'm going to do a video about addiction and just, how not only physically it tears your body apart, but mentally and everything else that happens when you have an addiction. Addiction could cause someone to want to kill themselves. And just feeling hopeless and helpless can cause someone to want to commit suicide. People are, there's an increase in homelessness. And not only just single people, families, the whole family is homeless. And they all begin to have this sense of helplessness and they just don't want to go on. And so I would say, if you know someone who is showing any of those signs, that you can walk in any emergency room and go in and tell the nurse or whoever you see first that the person or you are, I want to kill myself. I'm having really bad thoughts. I'm depressed. I'm angry, whatever, and I want to get help. As I always tell my clients that suicide is a symptom to a bigger issue. So the issue is depression. It's treatable, right? We can treat depression. We can help you learn coping skills to deal with your anger, to deal with trauma, to cope with loss. And so suicide is not the answer. That we can, in the field, and even a friend can help you to manage those feelings better. But of course, I would suggest that you get professional help. So that is it for this video. Don't forget to like, subscribe, and share this video with anyone and everyone, but especially anybody that is dealing with thoughts of suicide and depression. Okay, thank you.